For more on the rise in cases here in the United States, I'm joined by Thomas Russo. He's a doctor, professor, and chief in the Division of Infectious Disease at the University of Buffalo. Dr. Russo, just listening to Jim Spellman's story must have brought back some painful memories for you because that's what's happened in your state. We heard the health officials in Wisconsin saying hospitals getting overrun, ICUs strained, imminent staff shortages. New York, of course, got clobbered in the spring, but did manage to flatten the curve. What do you think when you hear these stories now about what's happening in the heartland?
Well, I think this is an important and ongoing lesson for everyone. It's critical that everyone realizes that using masks, physical distancing, and appropriate hand hygiene could really minimize the number of new cases. And I believe what's happening as the temperatures are getting cooler, people are heading indoors where the risks are greater, there's some fatigue about following these public health measures, that we're seeing a bump of cases, and as cooler weather will embrace a larger number of states, I'm concerned that the number of cases is likely to continue to go up over the ensuing weeks and months.
And ironically, just a couple of hours ago, your hometown newspaper posted this online from the editorial board: a second wave of COVID-19 infections approach. Region needs to stay vigilant. You've got cold weather, and it's pretty legendary there in Buffalo. That means a lot more people confined inside, as you mentioned. Thanksgiving just around the corner. You mentioned this fatigue that's setting in. Just how concerned are you about a second wave, even where you are?
Well, obviously, I'm concerned, and everyone should be concerned. But I think it's important for people to realize that they control their own fate to a degree. If they follow the public health measures that we've been preaching now for months, if they avoid gatherings of individuals that cross social bubbles, and particularly gatherings where food and drink is involved when one can't use masks, then I think we could tamp down the number of new cases and minimize the potential damaging effects of this new virus. So it's in our hands, and we have to go ahead and execute what we know works to prevent new infections.
Dr. Russo, we've got an election here in the United States. It's rapidly approaching. You have a vice presidential candidate, Senator Kamala Harris, who's suspending her travel. 2 people in her orbit just tested positive. Then you have the U.S. president doing events. He's had the coronavirus. There isn't a lot of social distancing when he does do these rallies. Lots of folks in attendance aren't wearing masks. Trump is actually heading to Janesville, Wisconsin this weekend for another rally. Give me your thoughts on these stark contrasts that we're witnessing on the campaign trail.
Well, unfortunately, there's a significant segment of our population that doesn't believe that using masks will prevent infections. The same segment of the population doesn't believe that this is a serious disease, which we've already seen is killed over 200,000 Americans, and that number is unquestionably going to go up. And so there hasn't been the best examples from certain individuals, and it would have been nice if we saw that, but I can't emphasize enough how important it is to use masks, to maintain physical distancing. We know this works. In fact, rigorous mask use you could almost consider like a pseudo-vaccine with a high degree of protection.
Let me ask you about herd immunity, because there's been a lot of discussion about that in recent days. Give me your take on that.
Well, trying to achieve herd immunity is a terrible idea. We'll have many, many more deaths in all age groups that could be avoided if we avoided getting infected and waited for the vaccine to arrive, which, though it's a number of months away, we're getting there. I think the other thing that's important for people to realize that we're not sure how durable and how effective natural infection may be. So even if you get infected, we certainly don't know if that's going to protect you down the line. And then lastly, and I think perhaps not talked about enough, there's both acute effects, but intermediate and long-term effects potentially from the new coronavirus. And we're still trying to understand the full implications of getting infected. So at this point, I think the best strategy to minimize the number of deaths and potential intermediate and long-term health consequences, the best strategy is to minimize the number of infections until the vaccine becomes available.
Yeah, we are seeing a lot of long haulers. Dr. Russo, thank you so much. Great analysis. Appreciate it.